The Compliance Perspectives podcast is sponsored by Athenian, a leading provider of entity management and governance software. Get started at www.athenian.com. Welcome to the Compliance Perspectives podcast. I'm Adam Turteltaub from the Society of Corporate Compliance and Ethics in Healthcare Compliance Association. Joining us today from Dave Pitney are Washington, D.C.-based Colton Kopcik and Hartford-based Phoebe Roth. And together they're going to be talking about an article they wrote for Compliance Today magazine entitled AI and the False Claims Act, Navigating Compliance in the Age of Automation. Colton, Phoebe, thanks for joining us. Colton, we'll start with you. There's been a lot of progress on AI, particularly in the area of billing and coding. The savings obviously could be just enormous, but what are the risks out there?
Thank you, Adam, for having us. Phoebe and I are both very excited to be here talking about this topic with you. And you're right, the savings potential with AI billing and coding is tremendous. It can essentially streamline the entire revenue cycle management process from beginning to end, in turn save a lot of money. But it's not without risk. And at the end of the day, the primary risk is going to be from a lack of human oversight. We know that AI moves very quickly, develops very quickly, and learns very quickly. So basically, human intervention is going to be needed at every step of deploying the technology to ensure that the technology doesn't take a small issue, run away with it, and leave a big compliance problem behind. In the area specifically of AI in billing and coding, one risk is going to be with upcoding. Upcoding is when a provider submits a billing code for a more expensive service than what perhaps was actually provided to the patient. So when artificial intelligence is involved with the coding process, it will deliver codes based on the data that it's given. And if it's given faulty data or it begins to learn a pattern that's not exactly in line with the current billing rules and regulations, it can deliver more expensive codes than what it should. And if the upcoded claims are submitted, it can lead to potential false claims risk. And AI operates very quickly. So imagine we have a AI-driven electronic health record system that's deployed across multiple urgent care clinic locations. That small issue and that bad lesson that it learned will continue to deliver false claims until someone steps in and corrects the technology. So that's why we're stressing the importance of human oversight, because you want to stop an issue as early as you can before it runs out of control.
And that leads to another question I had. Phoebe, what are some of the other areas of False Claims Act risk that you are seeing?
Thank you, Adam. In addition to the issues with AI, we're also seeing risk in telehealth and remote care fraud. The large surge in telehealth during and after the COVID-19 pandemic led to increased government scrutiny over telehealth, and potential False Claims Act violations are generally related to medically unnecessary services or improper billing for virtual care. And in 2024, the DOJ highlighted this rise in telemedicine fraud schemes, which signaled an increased government scrutiny in this area. So we recommend here that providers should verify that telehealth services that they offer are properly documented, medically necessary, and billed under appropriate codes in order to avoid FCA scrutiny.
On that point, one of the other areas of risk we're seeing is, obviously, I mentioned with failure to monitor the technology, outdated or incorrect AI algorithms. For example, if the algorithm is ignoring National Correct Coding Initiative, NCCI edits can result in improper claims. The risk here is not necessarily the AI tool itself, but failure to maintain and supervise it. The AI may be operating exactly how it should be, but if the humans aren't going ahead and providing the updates that come out of the government and the guidance sources, the AI will be, more risky.
And that leads to the question, what guidances are we seeing out of the government when it comes to the use of AI?
Yeah, absolutely. So We saw recently in September 2024, the DOJ updated their compliance guidance, which is specifically its evaluation of corporate compliance programs. And in this edit, the government addressed AI-related risks under the False Claims Act. And in this document, which can be quite useful for compliance programs, the government suggests that prosecutors consider several questions concerning AI. And a couple of these questions include, what is the company's approach to governance regarding the use of new technologies, such as AI, in its commercial business and its compliance program? And also, how is the company mitigating the potential for deliberate or reckless misuse of technologies, including by company insiders? So this document can be very useful for compliance programs, and we certainly recommend that healthcare providers look at this document. Another key piece of guidance that has come out more recently is Trump's executive order on AI titled Removing Barriers to American Leadership in Artificial Intelligence. And in this executive order, the president revoked existing AI policies and directives from the prior administration. And this document takes a completely different approach to AI and states that the policy of the United States is to sustain and enhance America's global dominance in AI. Now, as opposed to whereas the prior administration took a more compliance-based approach to AI and its guidance, this new administration is really focusing on positioning America as a business leader in AI. So we're seeing a totally different approach.
That is a very different approach. So what else should compliance teams be doing to ensure that the benefits of AI aren't quickly outstripped by the risks and ultimately the costs?
That's a great question. And really, compliance teams should be involved at every stage of the process when an organization is considering deploying a technology and all throughout the operation of the AI technology. But perhaps the most important is right at the beginning, when an organization is doing its due diligence on the AI vendor or the vendor who's going to be creating this platform, this technology for the organization. It's really important that compliance and legal review the agreements and the documents with the vendor to ensure that someone either on the vendor's side or someone internally on your team is going to be able to make real-time adjustments to the algorithm or to the platform and correct any issues as early as possible. As we mentioned, it's really in the best interest of the organization to stop a problem right at its source and right as quickly as possible. You can also consider a form of AI oversight committee. This committee could have individuals on it from IT, from legal, coders, individuals from the compliance side, from the clinical side. It's really important to make sure that there are individuals in the organization who know and understand how this technology is being used and how it operates. This committee can do things like track government enforcement trends. We know that it's really important for organizations to pay attention where government entities are placing their scrutiny, and the organization can respond accordingly. You could also review independent audit results to make sure that the technology is operating the way it should be. And also this committee can lead staff trainings. It's really important to have a workforce, to have employees who understand how this technology, how it works and how it's being used at your organization. In the area of False Claims Act cases, we know that the vast majority of whistleblowers in these cases are going to be the organization's former employees or former members of the workforce. So it's really important to pay attention to your staff members if they come to you with a potential issue. And a more AI-educated workforce is going to be better at spotting issues and coming to you and saying, hey, I think we have a problem here.
That's a really good point you raised, because AI tends to run in whatever direction it is going, and you need to have a staff person there watching and people willing to speak up to prevent it from going totally awry. So finally, what's the next frontier for AI in healthcare? We're not at the end of things. What do you think is coming next?
Well, that's sort of the million-dollar question, right? Because like you said, AI does evolve so quickly. It's very difficult to predict what's going to be the next big thing. That's also what makes it very interesting. I think what we're seeing right now and what we can predict to see an increase in is using AI tools in the entire revenue cycle management process, submitting claims faster, getting paid faster, doing things more effectively. Like we said, AI can be very effective and can be very accurate with the proper oversight and controls.
We're also seeing, in addition to the revenue cycle management and billing software, we're seeing some really interesting developments using AI on the clinical side of healthcare. So, for instance, we've seen some interesting developments in remote patient monitoring and virtual care. There's a company based in Singapore that's creating virtual hospitals where physicians can monitor patients remotely using AI, and this approach has allowed hospitals to essentially create hospital-grade care for patients at home. So this is just really increasing efficiency of care, and we think we may see more of that in the future. We're also seeing some amazing AI-enhanced diagnostics and predictive analysis. So AI just has the ability to enhance the diagnostic accuracy. And we've seen several interesting companies that are working on this. For instance, scientists at Harvard have recently created a ChatGPT-style cancer diagnostic model, which has achieved a 94% accuracy rate in detection of 11 different cancer types. So that'll be something really interesting to watch for.
And when we're talking about clinical decision support, it's interesting because in 2024, HHS issued a final rule reinterpreting Section 1557 of the Affordable Care Act, which prohibits discrimination in a health program or activity that receives federal assistance. Now, we know that that final rule went into effect in May of this year, but it remains to be seen how the Trump administration will enforce this rule at all, as it was put into place under the Biden administration. But basically, in essence, this rule says for each tool, a covered entity must make reasonable efforts to mitigate the risk of discrimination. And when you think about AI and clinical decision-making, discrimination is possible if there's faulty data or the data is not as universal and diverse as it should be in terms of clinical decision making. When you think about dermatology and the ability for AI to detect what might be skin cancer, well, skin color can play a major role in that. So depending on what data the AI model has been given, will predict the outcomes of that AI may be vastly different.
It's fascinating both professionally and personally seeing all the ways AI has already started to make its way into healthcare, and it'll be really interesting to see how it continues to evolve. Well, Phoebe, Colton, thank you both for taking the time to talk to us today. I want to thank all of you for taking the time to listen. I'm Adam Turteltaub from SCCE and HCCA. I hope we're able to expand your compliance perspective.